Question 1. Scenario question. Sarah, a healthcare professional, is providing care to an elderly patient, Mr. Roberts, who suffers from advanced dementia. Mr. Roberts has previously expressed that he does not want to be resuscitated if his heart stops. However, his family members are insisting on full resuscitation efforts, stating that they believe it is in his best interest. Despite his expressed wishes, Sarah is unsure how to proceed in this emotionally charged situation. What should Sarah do to ensure the ethical and legal rights of Mr. Roberts are respected? A. Follow the family's wishes, as they are legally responsible for making decisions on behalf of the patient. B. Inform the family that Mr. Roberts' prior wishes take precedence and that any resuscitation attempts would not be appropriate. C. Resuscitate Mr. Roberts regardless of his wishes, because family consent overrides the patient's prior expressed wishes in emergency situations. D. Consult with Healthcare Ethics Committee to clarify the appropriate action and ensure that both legal and ethical considerations are taken into account. Answer. B. Inform the family that Mr. Roberts' prior wishes take precedence and that any resuscitation attempts would not be appropriate. Explanation. According to healthcare law, patient autonomy is core principle, particularly regarding the refusal of treatment. Mr. Roberts has clearly expressed his wish not to be resuscitated, and this is legally recognized as valid directive. This is consistent with the ethical and legal principle of respecting patients to make decisions about their own care, even when family members may disagree. While Sarah could involve an ethics committee to facilitate communication, the primary focus should be on Mr. Roberts' previously stated preferences. Question 2. Which of the following actions is most appropriate for a health and care professional to take when they suspect a colleague may be struggling with substance abuse that is impacting their ability to provide safe care? A. Ignore the situation and focus solely on the patient's needs to avoid making personal judgments. B. Discuss the issue with the colleague privately and offer support, suggesting they seek help through the employer's health and support services. C. Immediately report the colleague to the regulatory body without speaking to them first to ensure patient safety. D. Continue working with the colleague as usual, as their personal issues do not affect their professional. Answer. B. Discuss the issue with the colleague privately and offer support, suggesting they seek help through the employer's health and support services. Explanation. The Health and Care Professions Council (HEC) guidelines emphasize the importance of professional accountability and the duty of care. Health professionals are encouraged to address concerns related to their colleagues' fitness to practice directly and compassionately. If substance abuse is suspected, the most responsible course of action is to have private conversation, offering support and directing the colleague toward available resources. It's essential to balance patient safety with support for the colleague's well-being. Immediate reporting should only be done if patient safety is at risk and after other options have been explored. Question 3. Which of the following actions is consistent with the principles of confidentiality and information governance within the healthcare setting? A. Sharing patient information with family members after receiving verbal consent, even if no written consent has been provided. B. Discussing patient care details in a public area, such as a hospital cafeteria, to seek advice from a colleague. C. Accessing patient records for a colleague without their knowledge to assist them with their patient's treatment. D. Sharing patient information with third party only when legally required and ensuring proper authorization is obtained. Answer. D. Sharing patient information with a third party only when legally required and ensuring proper consent or authorization is obtained. Explanation. The principles of confidentiality and information governance are vital in healthcare settings to protect patient privacy. According to the Data Protection Act (HEC) guidelines, patient information should only be shared with a third party when legally required or with explicit consent from the patient. Sharing of personal health information without consent or proper authorization violates both ethical standards and legal requirements. Healthcare professionals must always ensure that patient information is handled in a secure and responsible manner, keeping the patient's confidentiality at the forefront. Question 4. A healthcare professional is treating a patient who has expressed doubts about undergoing a recommended medical procedure. The patient has requested more time to think about their decision, but is concerned that their healthcare team might pressure them into making a decision sooner. How should the healthcare professional respond to ensure that the patient's autonomy is respected? They encourage the patient to make the decision as soon as possible to avoid delays in treatment, as the procedure is time sensitive. B. Respect the patient's request for more time and provide them with the necessary information to make an informed decision at their own pace. C. Pressure the patient to make the decision quickly, explaining that the longer they delay, the higher the risk of complications. D. Ignore the patient's concerns about pressure and proceed with procedure once the healthcare team determines it is the best option. Answer: B. Respect the patient's request for more time and provide them with the necessary information to make an informed decision at their own pace. Explanation: respecting patient autonomy is a cornerstone of healthcare ethics. The patient has the right to make their own decisions about their treatment, and healthcare professionals must respect this decision-making process. According to the principles of informed consent, it's important to provide the patient with the relevant information and allow them the time needed to fully understand their options. Pressuring patients into decisions can violate their autonomy and potentially lead to ethical or legal issues. Question 5. Which of the following best defines the concept of fitness to practice within the context of health and care professions? A. The ability of a professional to perform their duties without the risk of making mistakes. B. The overall health and well-being of a healthcare professional as assessed by a medical doctor. C. The professional's competency, conduct, and ability to provide safe and effective care throughout their career. D. The formal educational qualifications a professional must hold to practice in their chosen field. Answer: C. The professional's competency, conduct, and ability to provide safe and effective care throughout their career. Explanation: fitness to practice refers to a healthcare professional's ability to meet the standards of care and perform competently within their scope of practice. It encompasses not just technical competency, but also professional conduct, health status, and the ongoing capacity to provide safe and effective care. The HCPC's standards for fit to practice help to ensure that health and care professionals maintain the required skills and behaviors throughout their career. This includes continuous professional development, ethical conduct, and the management of any personal health issues that could affect their ability to work safely. Question 6. In a situation where a health professional notices a colleague providing substandard care to a patient, which action is in line with the HCPC's professional conduct standards? A. Report the colleague to the regulatory body immediately without further discussion, as patient safety is at risk. B. Ignore the situation because it is not the professional's responsibility to intervene in their colleague's actions. C. Approach the colleague privately to discuss the concern and encourage them to address the issue, following up as needed. D. Inform the patient's family about the substandard care while keeping the colleague's identity anonymous. Answer: C. Approach the colleague privately to discuss the concern and encourage them to address the issue, following up as needed. Explanation: the HCC emphasizes the importance of professional accountability and ensuring that patient safety is not compromised. When noticing substandard care, healthcare professionals should first attempt to address the issue privately with the colleague involved. This aligns with ethical practice and encourages a culture of communication and professional development. If the concern is not resolved or escalates, it may be necessary to report the issue to the regulatory body or other relevant authorities to ensure patient safety. Immediate reporting should be reserved for more serious concerns where patient safety is at immediate risk. Question 7. A healthcare professional is asked by their employer to perform a task that is outside their scope of practice. Which of the following is the most appropriate course of action? A. Perform the task to avoid conflict with the employer, as refusal could jeopardize the job. B. Attempt to perform the task even though it is outside of their competence and seek supervision while doing so. C. Politely decline to perform the task and discuss the situation with the employer to clarify the boundaries of their professional role. D. Perform the task, but do so reluctantly, informing the patient afterward that they were not fully qualified to conduct the procedure. Answer: C. Politely decline to perform the task and discuss the situation with the employer to clarify the boundaries of their professional role. Explanation: the ATC and other professional regulatory bodies emphasize that healthcare professionals must work within the boundaries of their competence. If a task is outside of the professional's training or scope of practice, they must not attempt to perform it, even if asked by an employer. The most appropriate response is to discuss the situation openly with the employer to ensure that roles and responsibilities are clear and that the professional is not being asked to take on tasks they are not qualified to perform. Doing so protects both patient safety and the professional's integrity. Question 8. Which of the following principles is most important in the context of safeguarding vulnerable individuals within healthcare settings? A. Respecting the autonomy of vulnerable individuals even if it puts them at risk. B. Prioritizing the needs of the healthcare system over individual patient safety. C. Reporting any suspicion of abuse or neglect, regardless of whether it is confirmed. D. Avoiding any intervention unless the individual explicitly asks for help. Answer: C. Reporting any suspicion of abuse or neglect, regardless of whether it is confirmed. Explanation: safeguarding is a critical element in healthcare, particularly for vulnerable individuals such as children, elderly patients, or those with disabilities. The principle of safeguarding requires healthcare professionals to act on any suspicion of abuse or neglect, even if it has not been fully confirmed. Reporting suspected abuse or neglect allows appropriate authorities to investigate and ensure that the individual is protected. Failing to report or intervening only when an individual explicitly asks for help can allow harm to continue. The duty of care takes precedence in safeguarding scenarios, and healthcare professionals are obligated to act in the best interest of vulnerable individuals. Question 9. What is the primary purpose of continuing professional development? CPD requirements for healthcare professionals. A. To ensure that professionals can maintain their registration with the HCC. B. To allow healthcare professionals to demonstrate their expertise by acquiring additional qualifications. C. To ensure that professionals stay up to date with current practices, technologies, and knowledge in their field. D. To provide healthcare professionals with an opportunity to earn extra income through specialized certifications. Answer: C. To ensure that professionals stay up to date with current practices, technologies, and knowledge in their field. Explanation: continuing professional development. CPD is a key requirement for healthcare professionals regulated by the HCC. The goal of CPD is not only to maintain registration, but to ensure that professionals remain up to date with the latest advancements in medical knowledge, technologies, and evidence-based practices. Ongoing learning process is vital for maintaining competency and delivering safe, high-quality care. CPD also helps healthcare professionals develop their skills, stay adaptable in an evolving field, and meet the regulatory requirements that support patient safety. Question 10. A healthcare professional is informed that a patient has made a formal complaint about their care. Which of the following steps should the professional take first? A. Ignore the complaint, as patient complaints are common and often not valid. B. Immediately deny any responsibility and explain to the patient that their complaint is unfounded. C. Acknowledge the complaint and begin to investigate the situation by reviewing the care provided and gathering relevant information. D. Apologize for the complaint and assure the patient that their concerns will be addressed. Answer: C. Acknowledge the complaint and begin to investigate the situation by reviewing the care provided and gathering relevant information. Explanation: in line with HCC standards and general professional conduct, it is important to take all patient complaints seriously. Acknowledging the complaint is the first step, as it demonstrates a commitment to addressing the patient's concerns. Investigating the issue thoroughly and reviewing the care provided allows healthcare professional to understand the nature of the complaint and take the appropriate corrective actions. Simply denying or apologizing without investigation may not resolve the underlying issue or may undermine trust in the healthcare professional. Question 11. Which of the following is the most important factor to consider when providing patient-centered care? A. Ensuring that care is delivered based on the healthcare professional's personal preferences and comfort. B. Focusing on the most medically relevant issues, ignoring the patient's personal preferences. C. Involving the patient in decision-making and respecting their preferences, values, and needs. D. Prioritizing efficiency and cost-effectiveness, even if it conflicts with the patient's wishes. Answer: C. Involving the patient in decision-making and respecting their preferences, values, and needs. Explanation: patient-centered care is a fundamental concept in healthcare, which emphasizes respecting and involving patients in their care decisions. This approach considers the patient's values, preferences, and needs, allowing them to play an active role in their treatment. While healthcare professionals must apply medical expertise, they should ensure that decisions are collaboratively with the patient. This ensures that care is tailored to the individual and that the patient's autonomy is respected. Question 12. A healthcare professional notices that A patient is showing signs of distress but is hesitant to voice their concerns. What is the most appropriate action for the healthcare professional to take? A. Ignore the patient's distress, assuming it will resolve on its own. B. Ask open-ended questions to encourage the patient to express their concerns and actively listen to their responses. C. Inform the patient that their distress is likely temporary and dismiss the need for further discussion. D. Tell the patient that they need to be calm and stop displaying distressing behavior. Answer. B. Ask open-ended questions to encourage the patient to express their concerns and actively listen to their responses. Explanation. When a healthcare professional notices that a patient is in distress, it is crucial to create a supportive environment where the patient feels comfortable sharing their concerns. Open-ended questions help facilitate a conversation and encourage the patient to express their feelings. Active listening is key to understanding the patient's needs and addressing any underlying issues, which is central to providing empathetic and effective care. Question 13. Which of the following is a fundamental aspect of effective teamwork in a healthcare setting? A. Focusing on individual success rather than team outcomes. B. Clear communication and collaboration to ensure patient safety and the best possible care. C. Prioritizing hierarchy and authority over mutual respect and shared decision-making. D. Working independently to avoid conflicts with colleagues. Answer. B. Clear communication and collaboration to ensure patient safety and the best possible care. Explanation. Effective teamwork in healthcare is essential for patient safety and providing high-quality care. Clear communication and collaboration among team members ensure that all aspects of the patient's care are considered and managed appropriately. Teamwork should focus on shared goals and mutual respect rather than individual success or hierarchy. Authority to deliver the best possible care and avoid errors. Question 14. When is it appropriate for a healthcare professional to disclose confidential patient information without the patient's consent? A. When the information is necessary for billing purposes. B. When the disclosure is required by law, such as in cases of suspected abuse or when the patient poses risk to themselves or others. C. When family member requests the information without the patient's consent. D. When the healthcare professional feels that sharing the information might improve the patient's care. Answer. B. When the disclosure is required by law, such as in cases of suspected abuse or when the patient poses a risk to themselves or others. Explanation. Confidentiality is a cornerstone of healthcare ethics, but there are situations where disclosure of patient information without consent is legally required. These situations often involve protecting the patient or others from harm, such as when abuse is suspected or when a patient presents danger to themselves or others. In these cases, healthcare professionals must act in accordance with legal and ethical obligations to safeguard well-being and public safety. Question 15. A healthcare professional discovers that a mistake was made during a patient's treatment. The professional is unsure whether the error will have serious consequences for the patient. What should be the first step in addressing this situation? A. Conceal the mistake and try to fix it without informing the patient or colleagues. B. Immediately inform the patient and healthcare team about the mistake and discuss the potential consequences. C. Wait for the patient to notice the error and address it only if they bring it up. D. Report the mistake to the regulatory body before informing anyone else. Answer. B. Immediately inform the patient and healthcare team about the mistake and discuss the potential consequences. Explanation. Transparency is essential when a mistake occurs in healthcare. The first step is to inform the patient and the healthcare team about the error. This allows for an open discussion about the potential consequences, the steps to mitigate harm, and any corrective actions needed. It also fosters a culture of accountability and trust. Errors can result in harm to the patient and undermine trust in healthcare professionals and the institution. Question 16. Which of the following is most likely to be a breach of professional conduct for a healthcare professional? A. A healthcare professional who maintains clear and open communication with patients. B. A healthcare professional who uses social media to discuss personal matters unrelated to work. C. A healthcare professional who engages in inappropriate personal relationships with patients. D. A healthcare professional who attends professional development courses to stay current in their field. Answer. C. A healthcare professional who engages in inappropriate personal relationships with patients. Explanation. Engaging in inappropriate personal relationships with patients is a clear breach of professional conduct. It undermines the trust and boundaries that are essential for providing ethical and effective healthcare. Healthcare professionals are required to maintain professional boundaries at all times to ensure that patient care is not compromised. Breaches of boundaries can result in serious ethical, legal, and professional consequences. Question 17. A healthcare professional is faced with a situation where a patient expresses dissatisfaction with the care provided. The patient threatens to file a formal complaint, but the healthcare professional believes the care was appropriate. What is the best course of action for the healthcare professional? A. Dismiss the patient's concerns as unreasonable and ignore the threat of a complaint. B. Explain to the patient why their concerns are unwarranted and try to convince them not to file the complaint. C. Acknowledge the patient's dissatisfaction. Discuss their concerns respectfully and offer to investigate the issue further. D. Respond defensively and argue that the care provided was correct. Answer. C. Acknowledge the patient's dissatisfaction. Discuss their concerns respectfully and offer to investigate the issue further. Explanation. When a patient expresses dissatisfaction, it is crucial for healthcare professionals to acknowledge their concerns in a respectful manner. This helps maintain trust and open communication. Rather than dismissing or arguing with the patient, the professional should engage in a constructive dialogue, listen actively, and take steps. Address any underlying issues. Offering to investigate the matter further shows a commitment to resolving the issue and improving care, which can prevent further escalation and protect the professional's reputation. Question 18. A healthcare worker is handling patient data electronically. What must they ensure to comply with data protection regulations? A. Only protect the data from external threats and not worry about internal misuse. B. Keep the data on personal devices for easier access provided it is encrypted. C. Ensure that patient data is only shared with individuals who are authorized and for legitimate purposes. D. Store patient data in physical form to prevent cyber attacks. Answer. C. Ensure that patient data is only shared with individuals who are authorized and for legitimate purposes. Explanation. Under data protection regulations such as the Data Protection Act (DDR), healthcare professionals must ensure that patient data is securely managed. This includes only sharing data with authorized individuals and for legitimate purposes related to patient care. Patient privacy and confidentiality are essential. Sharing data without proper authorization can result in significant legal and professional consequences. Securing electronic data, maintaining confidentiality, and following clear protocols for data access are necessary practices to prevent misuse or unauthorized access. Question 19 scenario. Mr. Thompson, a 75-year-old patient, has been admitted for a routine procedure. He is confused and unable to understand the consent form due to cognitive impairment. What should the healthcare team do next? A. Proceed with the procedure as the consent form has been signed by the patient. B. Ask a family member or legal guardian to provide consent on the patient's behalf if applicable. C. Continue with the procedure after explaining the form repeatedly to Mr. Thompson, assuming he will eventually understand. D. Disregard the procedure since Mr. Thompson is unable to understand the consent form. Answer. B. Ask a family member or legal guardian to provide consent on the patient's behalf if applicable. Explanation. In cases where a patient lacks the capacity to understand the consent process due to cognitive impairment, healthcare professionals must ensure that valid consent is still obtained from an authorized individual such as a legal guardian or a family member with the patient's best interests in mind. Proceeding with a procedure without consent can result in legal and ethical violations. It's critical to assess the patient's capacity to give consent and follow the proper legal procedures for obtaining consent from an appropriate representative. Question 20. A healthcare professional discovers that another team member has made an error that may affect patient safety. What should the professional do in this situation? A. Ignore the mistake and trust that the team member will correct it. B. Immediately report the error to a supervisor or appropriate authority to ensure patient safety is maintained. C. Confront the team member privately and discuss the error without involving others. D. Attempt to fix the error without informing the rest of the team or the patient. Answer. B. Immediately report the error to a supervisor or appropriate authority to ensure patient safety is maintained. Explanation. when a healthcare professional identifies an error that could impact patient safety, it is essential to report it immediately to a supervisor or the appropriate authority. This ensures that steps can be taken to rectify the situation and prevent harm to the patient. In healthcare, patient safety is paramount and accountability is key principle. Ignoring the mistake or attempting to fix it without informing others can lead to further complications and jeopardize the patient's health. Question 21. In a healthcare setting, which of the following actions best demonstrates professional accountability in practice? A. Accepting personal responsibility for mistakes and taking steps to correct them. B. Blaming others for mistakes to avoid personal liability. C. Relying solely on others to identify and address errors in patient care. D. Ignoring feedback from colleagues and patients about performance. Answer A. Accepting personal responsibility for mistakes and taking steps to correct them. Explanation. Professional accountability involves accepting responsibility for one's actions and ensuring that any mistakes or errors are addressed appropriately. Acknowledging mistakes and taking corrective actions is essential to maintaining trust, providing safe care, and ensuring continuous improvement. In healthcare, accountability is a core value, and it helps to foster a culture of openness, transparency, and patient safety. Blaming others, ignoring feedback, or avoiding responsibility undermines professional integrity and patient care. Question 22. A healthcare professional notices a colleague consistently providing inaccurate information to patients about their treatment options, potentially affecting patient care. What is the most appropriate course of action for the healthcare professional to take? A. Ignore the issue as it does not directly involve the healthcare professional's work. B. Address the issue privately with the colleague and report the behavior to a supervisor if the issue persists. C. Immediately report the colleague to the regulatory body without first speaking to them. D. Confront the colleague publicly in front of the patients to ensure they are aware of their mistake. Answer B. Address the issue privately with the colleague and report the behavior to a supervisor if the issue persists. Explanation. When a healthcare professional observes a colleague engaging in behavior that could negatively affect patient care, the most appropriate action is to address the issue in a respectful and private manner first. If the behavior continues or cannot be resolved through direct communication, reporting it to a supervisor or appropriate authority. Necessary to ensure patient safety, it's important to maintain professional decorum and handle such issues discreetly to prevent unnecessary conflict or distress for the patient. Public confrontations or immediate reports to the regulatory body may be necessary in extreme cases but should not be the first response. Question 23. A healthcare professional is managing a patient with a chronic condition and is tasked with developing a care plan. What is the primary goal of the care plan? A. To prescribe medication and monitor the patient's vital signs regularly. B. To ensure the patient is seen by specialists frequently regardless of the condition. C. To create personalized, holistic plan that addresses the patient's physical, emotional, and social needs. D. To follow standard protocols without considering the patient's individual circumstances. Answer C. To create a personalized, holistic plan that addresses the patient's physical, emotional, and social needs. Explanation. A care plan must be individualized to the patient's needs, focusing on the whole person, not just their medical condition. This approach is in line with person-centered care, which emphasizes the patient's preferences, values, and unique circumstances. It includes not only medical interventions, but also emotional, social, psychological support. This comprehensive care plan allows for better management of chronic conditions and improves overall patient outcomes. Focusing solely on medication, specialists, or standard protocols does not provide the personalized care needed for effective long-term management. Question 24. Scenario. Mrs. Garcia is a 65-year-old patient who is refusing a recommended medical procedure that her doctor believes is necessary for her health. Mrs. Garcia states that she has concerns about the procedure and its risks, and she feels overwhelmed by her options. How should the healthcare professional proceed in this situation? A. Ignore Mrs. Garcia's concerns and proceed with the procedure, assuming she will come to terms with it later. B. Encourage Mrs. Garcia to consent without further discussion to avoid delaying her care. C. Respect Mrs. Garcia's autonomy by acknowledging her concerns, providing further information, and allowing her time to make an informed decision. D. Pressure Mrs. Garcia to sign the consent form quickly to prevent any delays in treatment. Answer. C. Respect Mrs. Garcia's autonomy by acknowledging her concerns, providing further information, and allowing her time to make an informed decision. Explanation. In this scenario, the healthcare professional must respect Mrs. Garcia's right to make decisions about her own health and care. It's essential to recognize that patients have the autonomy to accept or decline medical procedures, and informed consent is a key legal and ethical principle. Healthcare. The professional should provide further information about the procedure, answer any questions, and ensure that Mrs. Garcia fully understands her options before making a decision. Rushing or pressuring the patient could undermine trust and lead to legal consequences. Question 25. A healthcare professional is working with a diverse group of patients from different cultural backgrounds. What is the most effective way to provide culturally competent care? A. Treat every patient the same, regardless of their cultural background, to avoid biases. B. Make assumptions about what a patient's cultural needs might be based on their background. C. Take the time to learn about each patient's individual cultural preferences and provide care tailored to their specific needs. D. Focus only on medical treatment and avoid addressing any cultural or personal concerns. Answer. C. Take the time to learn about each patient's individual cultural preferences and provide care tailored to their specific needs. Explanation. Culturally competent care requires healthcare professionals to recognize and respect the diverse cultural backgrounds of patients. This involves understanding each patient's values, preferences, and healthcare practices and incorporating this knowledge into the care provided, rather than making assumptions. Generalizing based on cultural background, healthcare professionals should engage in open communication, learn from patients about their specific needs, and adapt care to respect those cultural considerations. Providing culturally competent care improves patient outcomes and enhances the therapeutic relationship, fostering trust and cooperation. Question 26. A healthcare professional is faced with a situation where they are unsure whether a patient's symptoms are due to medical condition or psychological issue. What is the best approach to ensure accurate diagnosis and appropriate care? A. Rely solely on the patient's physical symptoms and ignore any psychological factors. B. Refer the patient immediately to psychologist without conducting any further assessment. C. Conduct thorough assessment of both physical and psychological symptoms and consider multidisciplinary approach to diagnosis and treatment. D. Ignore the psychological aspect and proceed with the treatment based only on physical examination results. Answer. C. Conduct a thorough assessment of both physical and psychological symptoms and consider a multidisciplinary approach to diagnosis and treatment. Explanation. In healthcare, it is important to consider both physical and psychological factors when assessing a patient's symptoms. Many medical conditions can manifest with psychological symptoms and vice versa. Comprehensive assessment that includes both aspects ensures that the root cause of the symptom identified. Multidisciplinary approach involving collaboration with other healthcare professionals such as psychologists or psychiatrists can help provide holistic diagnosis and treatment plan. Ignoring any aspect of the patient's health may lead to misdiagnosis or ineffective treatment which could harm the patient. Question 27. A healthcare professional is working with a patient who has expressed concerns about the cost of their prescribed medication. What should the healthcare professional do in this situation? A. Ignore the patient's concerns, as the cost of medication is not their responsibility. B. Advise the patient to stop taking the medication if they cannot afford it. C. Offer to help the patient explore alternative medication options or financial assistance programs. D. Insist that the patient take the medication as prescribed, regardless of the cost. Answer. C. Offer to help the patient explore alternative medication options or financial assistance programs. Explanation. When a patient expresses concerns about the cost of medication, healthcare professionals should work with them to find solutions. This may involve discussing generic alternatives, exploring financial assistance programs, or referring the patient to resources that can help reduce medication costs. Ignoring the patient's concerns, advising them to stop taking the medication can negatively impact their health and treatment outcomes. A proactive approach to addressing financial barriers is essential to ensure patients can adhere to their prescribed treatment plan. Question 28. A healthcare professional is caring for a patient who is experiencing severe anxiety related to an upcoming surgery. Which intervention is most likely to help the patient manage their anxiety effectively? A. Ignore the patient's anxiety and focus on the medical procedures to reassure them. B. Offer to perform the surgery sooner to alleviate the patient's anxiety. C. Provide information about the surgery, answer the patient's questions, and teach relaxation techniques. D. Suggest that the patient should try to manage their anxiety independently without professional support. Answer: C. Provide information about the surgery, answer the patient's questions, and teach relaxation techniques. Explanation: addressing patients' anxiety involves providing clear, accurate information about the procedure to reduce fear of the unknown. Answering questions and teaching relaxation techniques, such as deep breathing or guided imagery, can help the patient manage their anxiety and feel more in control. Ignoring the anxiety or rushing the surgery without addressing emotional concerns can increase stress and worsen the patient's psychological state, negatively impacting the overall care experience. Question 29. Scenario: a healthcare professional receives a report of a potential adverse drug reaction ADA from a patient. What is the first step the healthcare professional should take? A. Ignore the report if the patient's symptoms seem mild. B. Report the ADA to the appropriate regulatory body and document the incident. C. Immediately prescribe new medication to counteract the symptoms. D. Advise the patient to stop taking the medication without further discussion. Answer: B. Report the ADA to the appropriate regulatory body and document the incident. Explanation: adverse drug reactions and ADAs must be promptly reported to ensure patient safety and inform regulatory agencies. The healthcare professional should document the incident thoroughly and report it to the relevant regulatory body to contribute to the monitoring of drug safety. Ignoring the ADA or prematurely discontinuing the medication with assessment may jeopardize patient health. The healthcare provider should investigate the reaction thoroughly and involve the appropriate specialists or pharmacy staff to manage the reaction and adjust the treatment plan if necessary. Question 30. A healthcare professional is caring for a patient with a terminal illness who expresses a desire to stop treatment and focus on comfort care. What is the most ethical approach to take? A. Respect the patient's decision and focus on providing palliative care, ensuring their comfort and dignity. B. Encourage the patient to continue treatment, as it could potentially extend their life. C. Advise the patient to reconsider their decision, as stopping treatment may lead to worsening symptoms. D. Ignore the patient's wishes and proceed with the current treatment plan. Answer: A. Respect the patient's decision and focus on providing palliative care, ensuring their comfort and dignity. Explanation: in the case of terminal illness, it is essential to respect the patient's autonomy in their decision regarding treatment. If a patient chooses to stop aggressive treatment and pursue comfort care, the healthcare professional should provide support, ensure the patient's comfort, and manage their symptoms effectively. Encouraging the patient to continue treatment against their wishes can undermine trust and violate ethical principles of autonomy. Providing palliative care focuses on enhancing quality of life and addressing emotional, psychological, and physical needs in alignment with the patient's goals.